Are there other things that you have observed that doctors do to maybe help themselves in areas of some of these things we are talking about? Simple things, everyday things they do to support themselves in moving forward or coping with the system and the conditions of their work.
Sure. So some things to keep in mind, which people that aren't doctors might not even understand because it seems so obvious. But in medical training, when you're taught to suppress your own needs and put the patient first, how doctors spend hours without eating, sleeping, going to the bathroom, like they suppress their own physical needs
Mhm.
if they're on call for 36 hours. Then once they become an attending, sometimes they forget or they don't even know, like, am I really hungry? Like, they forget that they can feel all of the things, that other people can feel, and they
Yeah,
need things that that other people need because you're human. And
absolutely.
so just to get back, because it does get back to the very, very basics.
Right.
And the most important thing is making sure you're getting enough sleep. And
Hmm.
if you're not sleeping well, what is it the root of that? Is it if it's anxiety? And then just talking to somebody, like if you don't know why you're not sleeping, talk to somebody, anybody, whether it's a therapist, coach, mentor, friend, just have a conversation. And if you don't feel like you can uncover it, go see your own primary care doctor because doctors need doctors too.
Absolutely.
So, and also I think that doctors feel like they should know everything. They have to know everything. I'm smart. I can figure this out.
Yeah.
But that's not true. And like Dr. Michael Herschel said, you can't read a label from inside the jar.
Right.
So basically, if you're not feeling well in any capacity, seeking help is a strength, not a weakness.
Mhm.
And everyone in the universe needs help sometimes. So if you're not sleeping, try to get to the root of it. Is it anxiety? Are you having caffeine at night? Are you not eating right? Do you have indigestion? And then also making sure that you're eating healthy food. And if you find that you're on call or you're called in quickly, maybe have a go-to bag with things that are more healthy than chips out of the vending machine.
Yeah.
Whether it's a simple protein bar or a protein shake, like there's things that you can do and be prepared so you can feel well nourished.
Yeah.
And even exercise. And if you don't have time to go to the gym, again, the basic things that you would tell your patients. And like doctors, one doctor, Dr. Stephen Palenchuk, is in Canada, and he says, we know what to do, right? And it's things we tell our patients that you have to do them themselves.
Yeah.
Like you could take the stairs, you could park a little further away if it's
Yeah.
not an emergency. You
Absolutely.
could take a 10-minute walk.
Mhm.
You can keep exercise bands, in your office so they don't take a lot of, or even do some just standing up and sitting down. And actually, someone just told me yesterday,
Mhm.
she asked her doctor how they're doing, and their doctor shared some personal stresses. And she said, well, what do you do? And he said, I keep a jump rope here. And in between patients, he does a little jump rope.
Absolutely. Yeah, it just finding what works for you within your time constraints. Yeah. But just being conscious of that and then being intentional about it. Yeah, one of the things also working with doctors I've observed is that they require a level of structuring of their day in terms of the things you have talked about. Because with that level of structure, you miss out in a lot of things. You're working based on the pressure you have at work. So you must, I believe most of them require a level of intentionality in managing of their day. When to finish seeing patients, like some of them may take lunch to work, but they won't have the time. So you require a level of self-discipline to say, okay, this time I must fit in this, like the physical needs you mentioned. You shouldn't just suppress them or ignore them, but you need to respond because that's also part of self-care. Right. So I think that level of self-discipline and structure is one of the things I know that have helped a lot of my clients.
And related to that is setting boundaries
So,
because, again, in their training, doctors are taught to say yes to everything. and to learn that you have to say no, and it is important to take care of yourself, to take care of other people. And it can sound trite, but it is 100% true. So realizing that it is okay and healthy and critical to find ways that you can set boundaries, and you don't always have to say yes to adding another patient on your schedule. You don't have to say yes to an extra shift. Realizing the things that you do have control over and setting boundaries around that. And also, as you said, because doctors are so busy, prioritizing things that are a priority, because like anybody else, you can end up doom scrolling. Like they
Yeah.
say, like just mindlessly scrolling on YouTube or
Yeah.
Facebook or any of those things.
Yeah.
But if you have limited time, tell yourself, okay, I am a busy doctor. I know to be healthy. I tell my patients to exercise.
Mhm.
So if I have 10 minutes, I'm either, I'm going to do some squats, or I'm going to take a walk, or I have these exercise bands, and you will feel better. Or even practicing breathing techniques. I
Absolutely.
know myself, like I used to clench my teeth a lot, but after going through my cancer treatments and attending a meditation mindfulness,
Mhm.
I realized how important breathing is, and
Absolutely.
it can change and regulate your nervous system.
Absolutely.
So things like that is setting boundaries and prioritizing.
Absolutely. Yes, exactly. That's one of the things I particularly prioritizing because when you have priority, every other thing becomes optional. All right. So, but if you don't have priority, then it becomes a challenge. And
Right.
in one of my programs, we'll talk about the harmony system. There's a program I created for work-life balance. We talk about harmony system instead of work-life balance, but harmonizing life or integrating life and work because we believe there's no dichotomy between the work and life. Work is part of life. So when people come, people have this challenge of balancing work with life. But I created that program specifically for that. And one of the things I first emphasize in that program is the importance of having priorities, like you just mentioned. Yeah, so that's what brought that to mind. Having priorities is very, very important because if you don't have priorities, you're a busy person. A lot of things are calling for your attention, both at work, home, and in the community. So people will want you in everything they are doing. So you must set boundaries, you must have priorities, and know how to say no gracefully.
Hmm. Absolutely to all of that. And also, when you spoke of work-life balance and it is your life, I like it was maybe Dr. Susan McClellan Tolbert was the first one to share with me that she likes to call it harmony,
Oh, okay.
work-life harmony.
All right.
Because it's not, because I think if you feel, because I also just recorded an episode with a couple people where we talk about the terms wellness versus well-being.
Yeah.
And I have a friend with autoimmune disorders, and says she feels like wellness is not achievable for her.
Okay.
But if you talk about well being, there are some things you can do to shore yourself up. So it's
Absolutely.
the same time, if you talk work life balance, that might feel impossible.
Yeah.
And you'd always feel like you're prioritizing one over the other, and
Absolutely.
it would never feel good. But
Mm.
if you look at it as far as a harmony,
Yeah.
that sometimes it'll ebb and flow.
Yeah, just being agile enough to know which one, what to give more time into. You can't give other things 50-50. If you're trying to create that, that will cause you a lot of stress and you may not achieve that. And it creates a level of dichotomy between work and life, which really a lot of us enjoy what we do. So work is part of
Right.
life that we love to be part of. Because
Right.
without work, definitely life is not complete. So
Hmm.
whatever it is. So I believe people should enjoy what they do, which is one of the reasons why we do what we do. So creating that sense of dichotomy, life competing with work, sometimes can hinder people achieving a level of fulfillment in the work they do.
Hmm.
Yeah.
Yeah, absolutely to all of that.
Yeah, Kim, several chapters in the book show how personal struggles sparked transformation. From your advocacy work, what lessons can healthcare organizations learn from these narratives to create systems that support clinicians, mental health, and autonomy? Because we see that also we need a bit of the system, which is one of the biggest challenge we have here. A lot of people are expecting the system to change before they can do something, and that's not in anybody's control. So, what of the things we focus on is to help individuals while we expect certain changes from the system to happen when we may not be exactly sure of that. But from your experience, do you mind speaking to that, please?
Right. Well, and that's what you just said is exactly true. And the fact that you're in the UK and I'm America, and I've spoken with Simon Craig and he's in Australia, as sad, unfortunately, is these issues are ubiquitous over time and around the world.
Yeah,
And everybody, doctors will try to say the system needs to change. It's the system
yeah,
that's a problem. And it's a yes and that, yes, that's true. But there's things that individual physicians and healthcare leaders
mhm,
can do to shore themselves up
yeah,
and it's the culture of medicine
right.
that has to change. So I feel like the culture of medicine has to change starting in med school,
Mhm,
that you need to educate doctors on things they haven't been educated on, about even the things that we're talking about, like to prioritize self-care,
yeah,
and to set boundaries, and to prioritize in your life, because I think that happens when they're in med school. They let their hobbies fall away. And when you're a resident, because if you're working 80 hours a week, which that should even change
yeah,
too, like you don't have time for any of that. But then once you're in attending and you might have a little more time, you forgot, well, what did I even like to do? Or what music do I even like? Like sometimes all of that falls away. So
absolutely.
I feel like the culture of medicine has to change starting in med school,
Mhm,
residencies, and then another thing I've been doing some episodes about this year is trauma informed care. And
absolutely.
everyone needs to know. And I don't know if you've heard, or you might know about the ACEs score, if
Oh,
that's
yeah, yeah, yeah,
popular
yeah.
over there too.
Part
Yeah.
of what I use in my work. Yeah,
Okay, right. Because
yeah,
I didn't know if that was like a worldwide thing.
yeah,
But
yeah,
for any listeners that might not know, is there's a score, like basically how childhood traumas
yeah,
really deeply affect how you show up as an adult. And there's
absolutely.
things that you can score, like, did you feel safe at home?
Mhm,
Was someone an alcoholic that was
yeah,
caring for you? Like,
yeah,
there's certain, when you answer these questions, you get a score.
yeah,
And if you have a high ACEs score,
mhm,
then you really have been impacted by trauma and it affects how you show up as an adult. So
absolutely.
if everyone has awareness of that, because healthcare leaders,
Yeah,
some of them have been traumatized,
yeah,
and that can affect how they show up as leaders, or even like their lack of empathy for physicians or other
yeah,
healthcare workers, right?
yeah,
And then physicians and other healthcare workers, they're no like less likely to have experienced trauma, and possibly I've heard even more likely, like that's some of the reason they go into medicine.
yeah,
So then understanding that the things they've, not to minimize that the things that happened to them were actually trauma, and just how trauma informed care or coaching and or therapy is critically important. And then also, of course, patients, some of the patients show up with their own trauma.
come on.
So basically everyone is interacting with everyone else's trauma. So if everyone was just more aware of that,
Yeah,
they could try to be a little more kind,
yeah,
so if, and get help for yourself. So I would say it's two pronged, like recognize that most people have likely had some kind of trauma in their life. And if you feel like you need to work that out, there's therapy, there's coaching, and also, so work on yourself and be kind.
yeah. Absolutely. Yeah, talking about a score, yeah, that the study that started in the US and I think it's spread all around the world. I
Okay.
use it a lot in dealing with some of the clients I deal with. And I think here in the UK, we talk more of trauma-informed care, which
Yeah,
is
okay.
gaining a lot of awareness here too. I think I should be Oprah Winfrey and Dr. Bruce Perry. They wrote that book, What Happened to You? I think in that book they share a lot of how people can uh, uh, seek some intervention to support themselves, even if they had a high age score. But I think having that knowledge of that, that's part of what we teach in self-awareness, because when you have that information about yourself, it helps you to seek the right intervention. That those things happen to you does not necessarily mean you're doomed, but
Right.
if you don't do anything about it, particularly if you are not even aware how those things are impacting you as an adult, that's where the main challenge is. So first, that awareness and then seeking the right intervention. The type of things we help people create that awareness and then seek the right intervention, whether it's coaching, therapy, or mentoring to help you cope with the impacts or effects of such experiences.
Hmm. Absolutely. And for doctors, it affects how they show up at home because
Yeah,
they're trained to compartmentalize. And as you know, Dr. Michael Hirsch will say, after something terrible happens in room one, you're taught to like have that, leave your brain and then walk in and with a smile on your face into room two.
yeah,
And that's okay if you're dealing with emergency situations or during your work when you have to get things done. But if you never unpack it, you're going to run into trouble. And then by the time you get home, you're either so emotionally drained or you don't want to burden a spout, like things like that. And when you never unpack it, that can lead to relationship issues.
absolutely.
So you need to have someone to talk about these things with.
Absolutely, Kim. All right. Kim, the anthology invites readers outside of medicine to understand the real life of doctors. Yeah, so, really, that's one of the beautiful things about the book you put together with these doctors. And I'm trying to figure out what do you hope patients and the public will take away from these stories, and how can we all contribute to a more compassionate, sustainable healthcare culture? Because I believe every one of us may have a part in this. What should our viewers and the listeners, what should be their own part in what we're talking about? It's not just about the systems or the doctors, but also every one of us can bring in our own contribution.
Right, absolutely. So I think this goes back to my very first episode. I interviewed Dr. Todd Otten,
Yeah,
and when I said, I usually start by saying, what do you want our audience most to know about you? And I believe he said, I'm human. And so many doctors have since said that. So on one hand, other people would be like, well, of course you're human. Like, that's silly. But I think sometimes doctors themselves feel like they're superhuman or have to be superhuman. And then other people sometimes truly don't see doctors as human. They're like, oh, they're walking in with this white coat, and no matter what, they'll just take care of me or they'll fix it. But doctors aren't robots, and you are human. So doctors need to know that for themselves, and that they again can feel all the feelings. Anything that happens to other humans happens to doctors, and patients need to understand that. And if they have that awareness when they walk in, so just since I've been doing this work, I've heard some beautiful stories from people, and one will say, well, now when I went to see my doctor, like she's just back from her own cancer treatments, and I asked her, like, how are you doing? And to have like a conversation in a deeper way. Now, understanding that the doctor can set their own boundaries, right, as to what they choose to share or not. But when they see that a patient is genuinely asking them and genuinely cares, it's okay, as Dr. Michael Hirsch also says, to let little pieces of yourself show. Like being vulnerable doesn't mean you have to tell people everything about yourself. But he says as he's been a little more vulnerable as he's leaned into coaching, that it's made all the difference and it deepens relationships. So doctors can share and other people seeing them as human by being a little bit vulnerable or sharing a little bit with your patients. So it really is a two-way street because there is like a hierarchy. You figure like the doctor in that situation is the boss and the patient is the patient. But if the doctor genuinely cares about and sees the patient as a human,
yeah,
I know one of my own doctors, we always talk about our vacations. And it's just something that kind of brings that humanness to it.
yeah,
So I think that's one thing is that these stories, and when you read them, you will see doctors as human, and that makes a difference. And again, that like saying thank you can't be underrated. Doctors have told me that like a patient thank you has changed the trajectory of their whole day.
Right,
Or they'll say that a lot of doctors say they have a whole drawer of like gifts that patients have given them or thank you notes. And when they're having a hard time, they
right.
pull that out and that helps sustain them or keep them going. So for patients not to underestimate either in the moment a genuine thank you or later sending a thank you note.
Absolutely. That appreciation, I think, goes a long way because from what we know is that even in the things we do, um, if you get one negative report, you may, even you
Yes.
can forget the 10
Right.
positive ones you
Right.
got before. So
Right.
really, every contribution, thank you, gift, all of those things, I think it makes a lot of difference because they can fall back to read those things and when somebody complains or when somebody does something or something goes wrong, I think that would be a great way of supporting maybe doctors and other healthcare professionals in their work. I think I love that very much. Yeah, because people just think really there's not much we can do. They only need to be paid well or they are paid well in some
Right.
places. So they are well off. They are better than us. So those type of thinking, it doesn't help anyway. It doesn't help their situation. I think that appreciation shown by patients go a long way, and some prefer it even more than whatever reward they are getting in the work they do.
Right. My friend Pat had shared with me she was a nurse and then she became a lawyer and she had to stop as she developed Parkinson's syndrome. And she said to me that doctors are expected to be superhuman and not complain because of their salary. A lot of patients don't have empathy for them because they think a doctor's life would be the ultimate.
Yeah.
And that's why I feel like, and I actually quote that in this book.
Mhm.
And that's why I feel like when people read these stories, they'll see the humanness and the struggles that doctors are facing, and it sheds light on that. And that's so important.
Absolutely.
And then also that also like doctors can support their colleagues as well because what you're speaking to, I've had ER doctors tell me they go to work every day not knowing they're making a difference and they're literally saving people's lives, but sometimes like patients don't thank. I've heard doctors share stories where they literally save somebody's life and they don't get so much of a thank you. But then you hear, oh, you remember Mrs. Smith from yesterday, right? And that they should have ordered a test or procedure, something like that. So, like you're saying, when you're not getting the thank yous and then you only hear about the bad things, it skews your own perspective and it needs to be spotlighted that the work you're doing is making a difference. So I would like to take this opportunity to thank every doctor out there. Like when the chips are down, we need doctors. And that's why
Absolutely.
I'm doing this, right? So we
Yes.
want them to be happy and healthy. And Dr. Kathy Stepien says everyone wins when physicians are well.
Yeah.
So I feel like if we help have patients understand that patients can be advocates for doctors, and if your doctor is physically and emotionally well and has the resources that they need, then you'll get better care.
Absolutely. And that's really one of the major reasons I do what I do, because I believe that we should support doctors to enjoy their profession, what they have spent, how long they spend in qualifying as a
Right.
doctor and all the rigor they go through to qualify as a doctor. And here in the UK, we see a lot of people exiting the profession to go and do something else. And I just think giving them some support will encourage a lot of them,
Mhm.
particularly the type of emotional and psychological support we give, not just in the sense of rewarding them, but just helping them in those small things, recognizing their emotions, training, and those areas of support that can help them stay in the profession and they not just stay in suffering, but stay in and enjoying it gives me a level of fulfillment in my own work too.
Yes, I absolutely love that. And I think that's one of the things that coaching does because Dr. Michael Herschel share, that he was burnt out himself. And then through coaching, he realized he didn't have to leave medicine,
Yeah,
that he can have the life he wants right now. And
absolutely.
it's just, again, taking a look at the things that you do have control over and taking those little steps to have the life that you want now. And many times that means not leaving medicine, and everyone wins. Also, when we have more doctors, because patients now are waiting months to see a doctor, and that will only get worse. So, if you have a happy doctor that stays, everybody wins.
Yes, absolutely. We need them.
100%.
I want them to stay. Kim,
Me
thank you
too.
very much. Is there anything more that you think maybe our viewers and listeners may want to know before we end this episode?
No, so well, how I always end my own episodes, which I guess I could share with you, as I say in closing, to move the needle in healthcare, we all need to care about each other.
Absolutely.
We already know that doctors need to care about patients. Patients need to care about doctors too. So stand up, doctors, and let's stand up for doctors.
Absolutely. And just like you mentioned a few minutes ago, doctors, you don't need to leave this profession. I think support is available, which is why we are doing this. I just think a lot of doctors are not trained to seek support, which is the major challenge. And asking for help is not a sign of weakness, like you said. It's a sign of strength. So it's a level of awareness. So support is available, and those supports are not, it doesn't mean anything. It doesn't really change anything about who you are, but then it helps you to enjoy what you do more, right? Or even stay instead of quitting. So support is available, which is why what we're sharing here to let to create that awareness that just a little support can make a great difference. So please reach out, take care of yourself as a doctor. First of all, self-care is very important because by taking care of yourself, you are preparing yourself to take care of other people, right? So you are in a better position to take care of other people when you take care of yourself. So taking care of yourself is part of taking care of other people. So I hope we don't forget that. So you must be in a good place before you can look after other people. And we really appreciate the work doctors and other healthcare professionals do. We appreciate you so much, and we may never fully express it in words, but some of us have this opportunity to say it. Other people may not, but I believe we are speaking for a lot of people that appreciate their doctors and other healthcare professionals. We value you greatly, and we really would love you to enjoy what you do. So, this episode is just to say thank you to all of you and continue the good work. If you need our support, we are here to support you. Thank you so very much. Kim, I can't thank you enough for joining me and sharing this great insight. I love the work you are doing, and I know you will continue doing it more and more, and it's impacting lives. And that's really the essence of what you do, changing the lives of doctors. And actually, when you change the life of doctors, changing the life of their families and other people connected to them. So, great job you are doing. So I really value you. Thank you so very much for the contribution and the things you have shared with our viewers and listeners. Thank you so very much, Kim.
And thank you very much. I really appreciated the opportunity.
Thank you. All right. So until next time, thank you, everyone. And bye for now. Thanks, Kim.
Thanks, Owen.
Thank you.